So.
All right. Well, I won't tell the audience that right off the bat. So keep those questions coming.
All right, Rosanna, whenever you're ready, go ahead and take it away. Thank you to our live stream audience for joining us. Rosanna, the show's yours.
All right. Thank you very much. All right. Well, good afternoon, everyone. I'm Rosanna Marcus, the Volunteer State President for AARP Illinois. Thank you for joining us today live on Facebook. I want to welcome you to this dynamic discussion about COVID-19 vaccines in your community. Today we are live with Tony Preckwinkle, President of the Cook County Board of Commissioners, and we are also joined by Jackie Serrato, Editor of La Voz Chicago Sun-Times. Our live conversation will take a deeper dive into understanding the COVID-19 vaccine rollout in Cook County, discussing vaccine efficacy and safety, and learning how, when, and where you can get your shot. We will also be addressing your questions and comments posted throughout the conversation on Facebook and YouTube feeds. I encourage you to have a pen and paper ready to write down important phone and web information that we will be providing you so that you can get access to continually updated information about COVID-19 resources for you and your loved ones. AARP, a nonprofit, nonpartisan membership organization, has been working to promote the health and well-being of older Americans for more than 60 years. In the face of the global coronavirus pandemic, AARP is providing information and resources to help older adults and those caring for them. I think we're all grateful that 2020 is in the rearview mirror. COVID, of course, is still with us and will be for some time. But 2021 holds the promise of broad vaccine distribution across the country. Yet, just a few months into the new year, major challenges remain. The virus is mutated, and continued outbreaks nationwide show just how difficult prevention efforts can be. And while vaccines are here and more are on the way, distribution has been challenging, and many Illinoisans continue to feel the emotional and financial hardship from the pandemic and fears about what is to come. In the face of the coronavirus pandemic crisis, AARP is providing information and resources to help older adults and those caring for them to protect themselves from the virus and prevent its spread to others. If you would like to stay on top of the most recent and up-to-date information after this call, you can visit aarp.org/coronavirus or coronavirus.illinois.gov, or call the toll-free Illinois Department of Health hotline to make an appointment. That number is 1-833-621-1284. For Cook County residents, you can go to vaccine.cookcountyil, all one word, .gov, or call 833-308-1988. If you would like to ask a question anytime during this live conversation, please post your question or comment in the Facebook or YouTube feed. This will place your comment or question in the queue for us to discuss live. We are fortunate this afternoon to have with us Cook County Board President Tony Preckwinkle, as well as the editor of La Voz Chicago Sun-Times, Jackie Serrato. Thank you, President Preckwinkle, for taking time out of what I know is a very busy schedule these days to speak with us. Would you like to share a few brief comments to kick us off?
Well, thank you very much, Rosanna. I'm grateful to AARP for providing this forum, and Jackie, thank you for joining us and for the support of the Sun-Times. I've been a member of AARP for more than a decade, so this is my tribe. I really appreciate this opportunity. You know, this has been an extraordinarily difficult year for me and for, I think, all elected officials in our country, especially those who are executives and responsible for the health and welfare of their residents. I was really encouraged, frankly, that President Biden has made it quite clear that he's going to make dealing with the pandemic, trying to be sure that everybody gets vaccinated and that the country recovers, the priority of the beginning of his administration, the focal point of his work. That's really encouraging. And I was also grateful, frankly, that he acknowledged our losses, that we've lost 500,000 Americans in the last year. 500,000 Americans, more than in World War I, World War II, and the Vietnam War combined. That's somber and sobering. And we've got some challenges, as you pointed out. We continue to have challenges with vaccine production and distribution, but I'm hopeful. I'm hopeful because I see the light at the end of the tunnel. Isn't that the expression? The light at the end of the tunnel. The fact that the president has made vaccine production and distribution his priority, I think, is really encouraging. And his State of the Union speech, in which he said that by May 1st, adults in this country, all adults, will be able to have appointments. That doesn't mean they're going to get the vaccine instantly, but they'll have appointments for vaccination is really tremendously encouraging. So I've gotten my shot. I encourage everybody on this call to get your shot. The first one, with a little pain in my arm. The second one, for about 3 hours, I had a headache. But it doesn't matter which vaccine you took. I had the Moderna one, whether it's Pfizer or Moderna or Johnson & Johnson. Take whatever opportunity you have to get vaccinated. And then please be an evangelist for vaccination. We've got to encourage everybody, especially our seniors, to get the vaccine, because we know that seniors, along with Black and Brown communities, have been both most decimated by the pandemic. So I'm very grateful again to be with you this afternoon. I'd be pleased to answer your questions. And I encourage you, if you haven't gotten your shot, do it. And then encourage everybody you know, family, friends, neighbors, to do it as well.
All right. Thank you very much for bringing that important message to us, President Preckwinkle. And now I would like to introduce Jackie Serrato, who is the editor of La Voz at the Chicago Sun-Times. Jackie, would you like to share a few brief comments?
Thank you, Rosanna, for the invitation. I'm happy to be in such great company here with Madam President Toni Preckwinkle and other staff from the Chicago Sun-Times. I have been following the COVID vaccine rollout, particularly in communities that are predominantly Latinx and Black. And we have found a great disparity. And we understand that a lot of that has to do with the phased rollout that initially applied only to healthcare workers. However, as we've seen the rollout expand its eligibility, we've seen that a lot of this disparity continues. We're still seeing that there are a lot of COVID cases in Black communities like Austin, for example, South Shore, Roseland, Ashburn, and also Latinx communities like Little Village, Belmont Cragen, Pilsen, back of the yards. However, there have been efforts at the municipal and at the county and state level to really level the playing field. And there is currently a campaign called Protect Chicago Plus, which is essentially a vaccination campaign, an informational campaign in these communities to reach out to people who are currently eligible for the vaccine, many of whom are essential workers, many of whom are Black and Brown. And while there is the reality that vaccine hesitancy really is a thing in many of these communities, I think the bigger issue is lack of access. For a while, there were people who were struggling simply to find a vaccination site near to where they live. Not only that, but to be able to book an appointment has really been a struggle, a headache. It's been an extremely frustrating experience for many families living in these communities. And unfortunately, a lot of the vaccine appointments, are booked online. A lot of the listings of available appointments can only be accessed through a phone application or through a particular website, which means that this process is leaving out a lot of people who may not have, reliable access to the internet or to devices or to the English language to be able to navigate these platforms. So there is hope. I am seeing that in the last few weeks, about half of vaccines in the city of Chicago have been going to Black and Latinx people, but I think there's a lot of work to be done.
All right, thank you very much for being with us this afternoon, Jackie. I would like to remind friends joining us live on social media that you are listening to AARP's live conversation on caring for your loved ones during the pandemic, and we welcome your comments and questions in the feed. We indeed have some questions that have already been submitted, so let's just get right to it. President Preckwinkle, please highlight how the mass vaccination sites are going. What resources can viewers write down to help, or any other insights you might have on what's to come?
Okay, well, thank you for the question. First of all, let me respond to Jackie a little bit. I think it's important for our listeners and our viewers to understand that we have three entities that are working to vaccinate the people of Cook County: the state of Illinois, the county of Cook, and the city of Chicago. And Jackie mentioned communities that are all entirely within the city of Chicago and which are the responsibility of the Chicago Department of Public Health. Cook County is responsible for suburban Cook County. So the 134 cities, towns, and villages outside of the city of Chicago that make up Cook County. And so our vaccination efforts are focused on suburban Cook County because the city has its own Department of Public Health and its own vaccination program. Having said that, I think it's important to understand that we're having challenges not just in the city of Chicago and the county of Cook, but all across the country in terms of equity. That is, that African American and Latinx communities are not being vaccinated at the same rates as majority community. Now, there are a lot of reasons for that, which I won't trouble you with, but it's something we're trying to address. Last week, for example, we took our public health team to a senior building in Maywood to make sure that all the residents and staff were vaccinated, because we knew that this was a part of the county where we had high rates of infection during the two waves that the coronavirus hit us hard, and that the residents of that building were not, because we have the data, not being vaccinated. So we're looking at not just our mass vaccination sites, which is Tinley Park at the Convention Center, South Suburban College in South Holland, Triton College in River Grove, and then we have a mass vaccination site in Des Plaines. We also have some smaller sites at Fractional South High School, at New Trier High School. Fractional South, Thornton Fractional South is for educators. The one at New Trier is for first responders. I mean, we have some specialized locations where we're vaccinating folks, but we're doing our best to place our mass vaccination sites across the county in a way that reflects the impact of the pandemic. And that's been, I acknowledge, a tremendous challenge. And I'd go back to the point, we don't have enough vaccine yet, although, again, the Biden administration is making vaccine production a priority to meet the needs. And so I ask everyone to be patient. For the city of Chicago, I can't tell you, but for Cook County, it's vaccine.cookcountyil.gov, as Rosanna said earlier, and 833-308-1988, 833-308-1988 by phone to book an appointment. Thank you. Someone graciously put it up on the screen. So that's how suburban residents of Cook County can access vaccination sites. And as I said, there are a lot of reasons why Black and Brown communities are not being vaccinated. Part of it is, frankly, the miserable experience that Black and Brown people have had with the healthcare system historically, and the way in which our communities have been used for experiments by the federal government. The most despicable, of course, that comes immediately to mind is this Tuskegee study, where people were not treated for syphilis so they could figure out what the course of the disease was over time. But there are all kinds of ways in which our communities have been abused by the healthcare system. But I would point out now that white people in this country have less hesitancy to get the vaccine than Black and Brown people. So if we're worried about this being an experiment on Black and Brown people, white people are stepping up. So I encourage Black and Brown people to get out there and get their vaccines. And furthermore, not just to get your vaccine, but become an evangelist. You know, it's important that people who get the vaccine tell everybody else, hey, it didn't kill me. You know what I mean? I was sick for a couple hours, or I felt miserable for a day or two. But I know that these vaccines protect me 100%. I'll say this again, 100% from dying of the pandemic. I mean, wait a minute, who wouldn't take that? A couple of days at most of discomfort, and you're protected from succumbing to the disease. That seems like a good bet to me. It's better than the lottery.
Hear, hear, President Preckwinkle. I've got another question for you. Please discuss the current efforts in suburban Cook County to assist homebound residents to get access to the COVID-19 vaccine.
Well, we are going to be rolling out efforts to try to address the need to vaccinate homebound people. I will tell you that our first priority is the mass vaccination sites. And in Tinley Park and in Des Plaines, for example, we're vaccinating more than 2,000 people a day. And if we have more vaccine, we can ramp up those sites to 3, 4, 5, 6,000 people a day. And that'll be wonderful. So I'm looking forward to that day. We're also doing what we call pods, points of distribution. So we're going to senior facilities, for example, as I expressed, we went last week to Maywood. So we're going to senior facilities and vaccinating all the residents who wish to be vaccinated, all the staff who are there, who serve those residents every day. And over time, we're going to be doing basically visits to homebound. It's coming. It's not here now, but it's coming.
All right, thank you. All right, Jackie, this question is for you. We know you've been doing so much data collection. Can you share some insights and highlights for viewers today, the trends that you're seeing with COVID-19 positive cases and deaths? And do you see a new wave of cases on the horizon?
I think, as Madam President Toni Preckwinkle mentioned earlier, we are seeing a light at the end of the tunnel. We're seeing an increase in vaccines for Black and Brown residents, but at the state level, I think we're still seeing that 69% of vaccines are going to white residents. So as we've talked about, the disparity continues. Of course, there are many different reasons for that. In particular, the Latinx community, which lives in very dense and close quarters with each other. It's a very family-oriented culture and community who also tend to be essential workers. I feel like they are at some, they're among the highest risk populations in the entire city and state. However, there have been efforts, not just by the city, but also at the community level, to either partner with community clinics or to partner with private pharmacies to have pop-up events in communities that are highly impacted by COVID-19. A couple of weeks ago, we saw a one-day vaccine event in the Little Village community that was able to vaccinate 1,000 people, most of them who were Mexican, most of them who were either essential workers or the elderly. But unfortunately, this effort did not come from, our elected officials. It was something that had to be organized at the very grassroots level with community organizers who decided to seek out vaccine providers and partner up to host these events. I know that we're seeing more of that. Every weekend, there are more pop-up events across the South and West sides. I know that Madam President Toni Preckwinkle is planning a vaccination event, I believe in Pullman with Alderman Beal. And there are similar efforts across different communities where aldermen are taking the initiative, and not just aldermen, but community organizations to partner with, with different vaccine providers, whether they are publicly funded or whether they are private providers like Walgreens or CVS. One data source that I follow pretty religiously is a ShyVax bot, which is an open source. Essentially, it's a robot on Twitter that on a daily basis, every single evening, it updates how many people in the city of Chicago have been vaccinated and where those people live. So although we continue to see the disparities between the people being vaccinated in the downtown area and the north side versus the people who are being vaccinated in the south and west sides, we are seeing that the numbers are rising in these neglected communities. So if you go to twitter.com/ShyVaxBot, you will see these numbers update every single evening. And let me just visit it really quickly. Right now, we are reporting that 268,000 people in Chicago have been vaccinated. That is close to 10% of the population. So there are still 90% of Chicagoans that need their vaccine.
Yeah. Now,
If I could add a couple things.
sure thing.
First of all, for this audience, 32% of those over 65 in Cook County have been vaccinated. So we're doing a lot better with our senior citizens, people with gray hair like me, than we are with our total population. So I think it's important to remember for this audience, about a third of the people over 65 have been vaccinated. We need to do a lot better, let me tell you, but that's better than if you average it out over the entire population. And the other thing is, there's one mass vaccination site in the city of Chicago, and that's United Center, pretty centrally located. And the zip codes, which have been most heavily impacted by the pandemic, are a priority for getting vaccination appointments. So if you live basically in a Latinx community or an African American community that has been decimated by the pandemic, your zip code will be a priority in appointments for United Center. So people should sign up at United Center, and they're giving out at United Center the Johnson & Johnson vaccine, which is 1 dose rather than 2. So it's a little easier to manage to just get your arm stuck once. So I encourage you to sign up for the United Center if you live in the city of Chicago for United Center vaccines. It's the Johnson & Johnson one, 1 dose, and zip codes, as Jackie said, in communities that have been most heavily impacted are a priority for getting appointments. So when you punch in your zip code, you'll be prioritized if you live in a community that has been heavily impacted by the coronavirus.
All right, thank you. Thank you for that. President Preckwinkle, next question is asking about the status of nursing home residents and staff vaccinations in Cook County. Now that the federal nursing home vaccination program is ending, what are your team's next steps to ensure residents and staff continue to receive access to the vaccine?
Well, first of all, we were informed last week that a nursing home in one of our suburban communities, which had been a hotspot during the pandemic, the residents had not been vaccinated. So we sent our Cook County crew to that nursing home to vaccinate people. And as we become aware of situations like this, we've offered this service previously. And frankly, the federal government allocated vaccine to Walgreens and CVS to go visit these nursing homes, these long-term care facilities, and distribute vaccines. So that was their assignment. Okay. So to the extent that that assignment has not been fulfilled by the pharmacies, we're happy to step in. But that was the way the federal government organized vaccine distribution. The 2 big pharmacies, Walgreens and CVS, were supposed to go to the nursing homes and vaccinate people.
All right. Thank you. For those of you just joining us, my name is Rosanna Marcus, and you are listening to a live conversation with Cook County Board President Tony Preckwinkle and Jackie Serrato, editor of La Voz Chicago Sun-Times. If you would like to join the conversation, although we just have a few minutes left here, but please post your question or comment in our Facebook or YouTube feed. President Preckwinkle, another question that's coming up from a few folks. When will Cook County open vaccination eligibility up to Group 1C? And a related question that's coming up is beyond seniors, when will the county open the vaccination opportunities to the 50 and plus? Is there a plan to do still senior but less senior folks?
Well, I think the next, at present, 1A is healthcare workers and long-term care residents. 1B is essential workers and those over 65. And right now we're in 1B. The next group is B+, which are people 16 to 64 who have comorbidities, who have other challenges, diabetes, hypertension, whatever, okay? They're cancer survivors. So 1B+ is next, and then 1C. And frankly, as we have vaccine available, we will, of course, open up appointments to other groups. But at the present, we're focused on 1A and 1B because we still have lots of people in those categories to vaccinate. And again, in Cook County, 32%, about a third of our seniors have gotten vaccinated. That means 2/3 aren't vaccinated. So I need everybody to step up, get their vaccine, encourage their friends and families to get the vaccine. Step up.
Yep. Okay. This might be our last question. Let's see. Well, so several audience members, you are already spoken very forcefully, President Preckwinkle, to take the shot, take any shot, whichever version comes in. But there are a number of questions. I want you to speak to this a little bit more. Several audience members want to know, are certain vaccines being offered in specific communities or facilities or locations? They're trying to think through which one should I take, but I want you to have another go at the three and why you ought to just go for whatever is available.
Okay, so there are three vaccines: Pfizer, Moderna, and Johnson & Johnson. Pfizer and Moderna are two course. You got to have two shots to be protected. The Johnson & Johnson vaccine is one shot, but you should take whatever vaccine is available to you as quickly as you can get it. All three vaccines protect you 100% from dying of the pandemic. All three. So, as I said, you should take whatever vaccine is available to you at the earliest appointment you can get. And that's my advice for everybody. Again, my own experience was, the first shot, I had a little bit of a sore arm. The second shot, after 24 hours, I got a little sick for 3 hours. I had a bad headache. Look, believe me, I'll take that any day of the week to being in the hospital or succumbing to the disease, okay? And even if I was sick for a couple of days, I'd take that too, okay? It's really important that people get vaccinated. There's no way we're going to bring our country back to normalcy unless we get everybody vaccinated. So, it's not just for your good health, it's for the health of everybody you love and care about, and for our country to move forward. So, my view is, even if you don't care about yourself, it's your obligation as a good citizen to do this, and be sure that you're not spreading the disease to anybody else and that you don't get sick.
Hear, hear. All right. I said that was the last question, but I am going to pose one more that I think is important as well, Jackie, to you. And it is just, can you share a little bit more about information and resources that you're hearing specifically are available for the African American and Latinx communities?
I don't think I've seen much information specifically targeted toward these communities, aside from the applications and platforms that people are using to sign up for appointments, which include the COVID Coach, ZocDoc, MyChart. These are all different platforms that people can sign up for. But again, these are not available in different languages. So unless you are English proficient, these platforms tend to be out of reach. I would like to give props to the hospitals and the Cook County healthcare system. Some of them that come to mind are Stroger, the University of Chicago Hospital, Rush, Mount Sinai, Holy Cross. They've been doing a really great job of reaching out to their patients, those who are already in their system, and offering appointments to people in Black and Brown communities. And I also want to send shout outs to the community clinics who are really doing a lot of the heavy lifting in terms of keeping the local communities informed, especially around this campaign called the Protect Chicago Plus. It's really the community clinics who are doing a lot of the outreach, the phone calls to their patients, who are putting out flyers and other communications that would hopefully reach people who may not necessarily have access to the internet. They're doing a lot of that outreach work. Aside from that, community organizations are playing a huge role in also holding events simply to sign people up for appointments, particularly those that don't speak English or aren't very digital savvy. A lot of local organizations are simply hosting events where people can stop by and try to sign up for an appointment through any one of these apps that I just mentioned. I do wish that when our former President Trump was around, that he would have taken COVID-19 more seriously and launched some kind of public information campaign, just like we do with the census, putting up billboards, sending out mailers, having people knock on your door. I think that would have been a great way to keep people informed, to dispel misinformation and to encourage people to get vaccinated, but it's never too late to do that.
All right, let me speak to that. So our sites in the county, vaccine.cookcountyil.gov, and the phone number, 833-308-1988, 833-308-1988, are in English and Spanish. English and Spanish, okay? We also launched yesterday, Jackie, the My Shot campaign, myshotcookcounty.com. I'll say that again, myshot.cookcounty.com. And it's English and Spanish, and it's focused particularly on trying to get members of our African American and Latinx communities to get their shots.
All right.
Beautiful.
Well,
thank you.
Thank you, Jackie, for highlighting the very good efforts that a lot of community organizations and groups are doing. They have been a tremendous resource as well, and I would join you in that shout out to them. So this has been a very informative discussion, but I am sorry to say that we are near the end of our time for this live conversation. But Cook County Board President Preckwinkle, I want to give you a chance to get in a few closing thoughts for our audience, please.
Well, thank you, Rosanna. Thank you, Jackie, for joining us today. Again, I encourage everybody who's watching, listening, get your shot, no matter what, whether it's Moderna, Pfizer, or Johnson & Johnson, whatever appointment is available to you, take it, get it as quickly as you can. After your second shot, if it's Moderna or Pfizer, or your first shot, if it's Johnson & Johnson, 14 days later, you're protected. So this is a really critical thing that you can do, not just to help yourself, but as I said, to help your family and your friends and your neighbors, to help our country deal with this pandemic. So I'm a history teacher. We haven't had a global pandemic like this for 100 years. So this, as I said earlier, is an extraordinary moment, and it requires of us, extraordinary actions. We need to do what's good for ourselves, what's good, as I said, for our families, and what's good for our communities, and that's getting our shots.
You're here. Jackie, would you like to share a few last thoughts with us?
Yeah, I definitely want to encourage everybody who's watching to, get their vaccine. If you've already gotten your vaccine, your 2 vaccines, please help other people in your household or friends and family, other people that to help them, get an appointment. Sometimes they may not have the capacity or the capabilities to be able to do it themselves. I would also say, don't put all of your eggs in one basket. If there are multiple platforms out there at the city level, at the county level, at the state level, use every single one of those resources, sign up to multiple lists, and, just pray and hopefully you'll get lucky and obtain an appointment through one of those platforms. I also want to add really quickly that grocery store and retail workers make up a huge chunk of our essential workers. And yet, they have very low rates of vaccination in their communities, which are predominantly West and South Side communities. And also restaurant workers and other workers in the food sector are not included in 1B phase. So right now we have a lot of restaurants and bars that are operating at 50% capacity, yet their workers are not included in the current phase of vaccination. So I just would like us to keep our frontline and essential workers in mind as we're trying to be more equitable with this vaccine rollout.
All right, thank you. Thank you again, both of you. And we thank you as well, AARP members and listeners, for joining us in this discussion. We apologize if we were not able to get to your question or address your comments this afternoon, but you can look for our next AARP Illinois live event on aarp.org/IL. Thanks again. I think you've heard the message loud and clear. We're doing everything we can, all of us, to make it as easy as possible for you to access that all-important vaccination. When you get your shot, to do so, take it, please. All right. Thank you, everyone, and have a wonderful day.
Thanks, Rosanna. Thanks, Madam President.
Yes, thank you both.
Thank you to everyone who tuned into today's live stream. We are going to leave the links and phone numbers for everything that was discussed up for a few minutes just in case you need to take it down.